Hi, this is Zach and Katie with Alpine Rescue Team. Today we're going to be going over airway management, suctioning, BVMs, OPAs, and NPAs. So this is a bag valve mask. This is used to ventilate a patient who is not breathing adequately for themselves. This is a suction device. It's going to be inserted into the back of someone's mouth to suction any type of fluid out there that could be including the airway. And both OPAs right here and NPAs here are used to help maintain an airway that could be compromised. OPAs are inserted in the mouth and NPAs are inserted in the nose. So first thing before you have to put in any airway device, you're going to suction if there's something including the airway. You're going to look in your patient's mouth and take the suction device and you're going to insert it into the back of their throat. Don't insert it farther than you can see the tip. Squeeze in like this, stick it down to the back of the throat, and suction just like that. And that's how you're going to do that. Most books say that you're supposed to do it for 10 or 15 seconds. Do it for as long as you need to get the airway clear. And if now that your device is suctioned, you have two options here to insert an airway. These are OPAs, or oral pharyngeal airways. They come in different sizes. Or you have nasal pharyngeal airways right here, the NPAs. An OPA is going to only be used on a patient that's completely unresponsive. So you don't use it on a patient who still has a gag reflex. They will throw up. If you stick this in and they start choking, pull it back out, be ready for them to throw up and put an NPA in instead. You're going to size these from the mouth to the ear, just like that. You're going to take it backwards, just like this, slide it in to the mouth, and turn, just like that, so it'll depress the tongue and keep it from occluding the airway. You can't slide it in like that because you'll shove the tongue back into their throat. So this is the most important part about putting an OPA in, is you slide it in like this and twist it as it goes in. With an NPA right here, these you size from the nose to the back of the jaw, just like that. You're going to, an NPA, do not use if the patient has some type of traumatic head injury that you suspect a facial fracture or skull fracture, but these can be used on patients that have a gag reflex. You want to lubricate the tube in some ways. Sometimes there's gels you have available you can use at patient's mouth and just stick it in and kind of get a little bit of their saliva on there as well. Stick it into the nose and just twist it like that and it will slide in. Keep in mind with this, their nose is going to bleed some. That's no big deal. That's just kind of normal, but yeah, that's the way you use an NPA. And then right here is a BVM, so if the patient stopped breathing or they're not breathing adequately, they're over 40, ventilated over 40 breaths per minute or under about 8, you're going to breathe for them. So you're going to take this, insert it over their mouth, get a good seal, and then just squeeze the bag like this. You're looking for equal chest rise and fall. You're also looking for a return. Often, if you're doing this, they're probably going to be cyanotic, diaphoretic, things like that. So you're looking for them, for you to get color back into their faces and things like that to show that you're actually inserting air into them. And that's the BVM.